Hey, my friends here in the live presentation, my friends out in Cyberland across all aspects of the globe tuning in. Thank you to the immense talents of our IT savant Phil over here has turned our Wine or Wellness Week or our Wellness Open House into a worldwide global phenomenon. I'm kind of a little bit proud to be able to say that I have people tuning in from other continents. But that's not the most important thing. My name is Gideon Orbach. I've been practicing chiropractic for, well, actually since December of 2001. So I'm up to a lot of years doing this. The last 16 and change have been here at this group. Started off as the Pain Release Clinic on the south side of Pittsburgh. We became the Weiner Wellness Center. Now we're the World of Wellness and the World of Nutrition here in Green Tree. Same group of people, new ideas, constantly upgrading, constantly expanding, constantly adapting to growing trends in healthcare. We do chiropractic, we do muscle release techniques, we do a lot of nutrition, we do some physical therapy modalities, we do very healthy on the nutritional consultations, we do a lot of that, and it's fun. And one of the most rewarding things is to see your clients and your patients and your shoppers and your people in your community just doing so much better and appreciating you for it. And that's exactly how our days are spent. Anyhow, my topic today was named for me once again. It's healthy holiday tips and things that I can suggest for you to make the holiday season a little bit healthier. I guess before we talk about things to do to make ourselves healthier, we should define the word health. We should talk about it as a concept. We should make sure that we're all on the same page. And at this point, I usually invite people to raise their hands and make this interactive and let me know what their idea of good health means. But since we're global, I want to make sure that that invitation is put out to people in cyberspace. And if you're watching on Facebook or YouTube or our web station or whichever platform our IT Savant Phil is hooked up for you, go ahead. If you want to participate, if you want to share, if you have questions, if you have comments, even moral outrages, feel free to chime in. But anyway, in the interest of time, I'm just going to share my definition of what health means. What does it mean to be healthy? We're all here shopping for nutrients, making appointments with our healthcare practitioners to be healthier. My idea of good health means having the ability to recognize, interact with, adapt to, and overcome your environment, both internally and externally. So our internal environment, that's our body chemistry. That's the things that we eat, the nutrients that we take, what we put into ourselves. How will our digestive processes work if we feed them healthy nutrients versus how will those same digestive processes work if we feed them processed food, if we eat too much sugar, if we eat the things that we're coached away from. So that's what's going on internally, our internal environment. Once our digestive processes come into action and they start to do what they're supposed to do, how will they influence, how will those nutrients be dispersed throughout the rest of the body? If we have a diet based on a lot of desserts and Coca-Cola and some fast food sprinkled in, that'll have impact on how your nervous system functions. That'll have impact on your musculoskeletal system. It'll have impact on how your body eliminates waste. Not good impact either. If you have a diet rich in fresh fruits and vegetables with the right amount of animal protein and the taster-sized portion of dessert and drink lots of water and take the appropriate nutritional supplements, your internal environment will thank you and it will function much more close to optimally. That's our internal environment. How about our external environment? Well, that's what's going on in the world around us. I am proud to announce that I'm a big part of your external environment right now if you're paying attention to me. You, if you're listening or if you're making noise or if you're jumping up and down, giving me teaser material, trying to draw me off topic, you're part of my external environment. So if we're driving along in rush hour commute to get to work and we're in bumper to bumper traffic, all those cars around us are part of the external environment. We have to recognize them, adapt to them, and overcome the traffic by simply paying attention to what we're doing behind the wheel. So far, so good. Phil, questions, comments, moral outrages? No. So hopefully we're all on the same page as what it means to be healthy. And when we set our goal of, I guess we're going to have a new goal for a new year coming up, and part of that goal list, everybody wants to be healthier. I'm going to take steps to be healthier in the new year. Well, that means we're going to do a better job of controlling what our internal environment has to deal with, and we're going to do a better job of adapting and overcoming our external environment. Anyway, I guess this is a good time for holiday tip, season tip number one. Be yourself. Just be yourself. If you're not used to eating big meals and you're not used to putting a lot of calories in your mouth, and you go to holiday parties and you're not a big drinker and you're not an extravagant person, and stay that way. You do not have to have a year's worth of holiday food, and you do not have to consume a year's worth of calories, and you do not have to drink a year's worth of alcohol in one sitting. If that's not who you are, honor that. I favor moderation in all things myself. So remember who you are and what you're about, and don't let the holiday season or the holiday influences turn you into somebody or something that you're not. Now, the rest of this conversation workshop, and I call it a workshop because people are invited, the audience is invited to participate and to be engaging and be engaged. The rest of this workshop, we're going to talk about tips of things that, what can I do for you, or any chiropractor for that matter? What can you do for yourself? What can I teach you how to do for yourself? Now, every single workshop that I do, in some way, shape, or form, I talk about breathing and the importance of big, deep breaths to calm our nervous systems down. And I can frame it in so many different ways. And the reason I do that is because it's so critically important. And being a good deep breather, relaxing your body systems, sucking down that delicious oxygen in an efficient manner, so absolutely critically important for good health. If you think you're going to be able to recognize, interact with, adapt to, and overcome your environment internally or externally, you better have the right amount of oxygen fueling yourselves to go. Can't be going lightheaded. Can't be starving ourselves and going hypoxic for good air and be healthy people. So I talk about deep breathing in the context of how do chiropractic adjustments facilitate deep breathing. I talk about how important good posture is for deep breathing. I talk about how important deep breathing is to reduce stress. Not a day goes by, not a day, where I don't see a patient who tells me about their physical aches and pains, and we go through a little bit of question and answering about how did this begin? Did you injure yourself? Is this part of buildup over time? Is this part of the rhythm of life? Did somebody injure you? Is this a flare-up of an acute condition? Is this an acute flare-up of a chronic condition? And we talk for a moment or two about people's aches and pains and what's going on with them physically. And not a day goes by where somebody doesn't punctuate it and say, I think it's just stress. Well, I'm not going to hang my hat on that and say, well, let's eliminate all the stresses from your life and you'll feel great. I'm a mechanical guy. I do chiropractic adjustments, more on that to come. I do pressure point muscle release technique, and I do stretching muscle release technique. So I'm looking for body dysfunction in order to correct it and help my patients feel more comfortable living in their bodies. But that doesn't mean the patients are wrong when they say, I think it's all stress. So the big tip and the big theme of the rest of the workshop is, what is stress? And how are we going to help you reduce it? How are we going to help you manage it better? What tools do we have at our disposal? Now, our nervous systems can be subdivided into two categories. Category number one is going to be voluntary stuff. If I ask you to raise your arm and wave goodbye, you understand the language. That's something you can do if you're so inclined. If I ask you to get up out of your chair and take a lap around the room, concentrating on good posture and breathing deeply as you go, if you want to indulge me, you can get up and go ahead. If you don't want to, you can remain in your chair and just chill out and listen. That's fine too. It's all voluntary nervous stuff. Now, if I ask you to dilate your pupils, or if I ask you to concentrate really hard and raise or lower your blood pressure, now we have a problem. That's non-voluntary nervous system event, non-voluntary function. You can't change your blood pressure just by thinking about it. I mean, maybe there's some very metaphysical people who do a lot of meditation and a lot of restorative types of exercises like Tai Chi, like yoga, who are able to control their blood pressure within a few points and parameters here and there. Those, my friends, are the outliers. That's not something that can be done just because. It's something you spend a lifetime training for. So our non-voluntary nervous system, we're going to term that the autonomic nervous system. And then the autonomic nervous system can be further subdivided into the sympathetic nervous system and the parasympathetic nervous system. When we think sympathetic nervous system, we think survival. If you're walking home at night and it's dark and it's a little cold and there are not so many people out and you have a choice, you can take a shortcut through a poorly lit, tightly packed alleyway, or you can walk along well-lit streets where there's some people out. It's a long cut, but it's pretty well lit and there are a lot of people out. And you think to yourself, I could save myself 5 minutes by walking through that alleyway, but who knows what's lurking in there? I'm going to walk on the main drag that's well lit and people are out. That's your sympathetic nervous system making a survival motivated decision. If Dr. Evil releases those sharks of his that have lasers on the back, are you going to swim around and try and get a closer look at this laser fortified shark who is going to do Dr. Evil's bidding? Or are you going to say, not for me, I'm going to swim away as fast as possible and get out of there? Compatible with survival, that's our sympathetic nervous system. Critically important. We would not have survived this long as a species without a sympathetic nervous system that will make those kind of decisions to keep us safe, to tell us when to fight and when to flee. It's good stuff, but it comes with a downside. When your body is engaged, when your sympathetic nervous system is engaged, one thing is going to happen is you're going to produce more cortisol, the stress hormone. You're going to have a compromised immune system. You're going to start to inflame. Your blood sugar is going to go up. Your blood pressure is going to go up. Your ability to breathe deeply is going to go down. Your heart rate is going to go up. So your body is in this jittery type of type A, wound tight, I'm ready to survive by whatever it takes, but I'm tense status. I don't know anybody who wants to live like that all the time. We have to have those faculties and those capacities, but we don't want to remain there. So far, so good? Okay, once again, we're being broadcast here internationally, globally. So if you're tuning in on the modern technology, which IT Savant over here to my left is controlling, feel free to join in. Just say hi and tell us where you're from. Now, in contrast to our sympathetic nervous system, we have our parasympathetic nervous system. More of a rest and digest. Parasympathetic nervous system is when we're absorbing our nutrients, our blood pressure is going down, our heart rate's going down, our respiration or our breathing rate is going down. We're relaxing. We're feeling calm. We don't feel the need to fight. We don't feel the need to flee. We're good where we are. Now, I'm going to suggest to you that if Dr. Evil releases those sharks with lasers attached to them, and you're in your parasympathetic nervous system state, you could be in real trouble. The sharks will eat you or they'll blast you with the lasers. Neither has a good outcome. If you're in your parasympathetic state and you're wandering home on a dark, chilly night and you think, cool, I can walk through this poorly lit, sparsely populated, if all, alleyway and save myself 5 minutes. Not a good plan. That's parasympathetic nervous system in action. So hopefully you can see that both parasympathetic and sympathetic are critically important to our survival, but they both have their time and their space. So let's talk about things that we can do to help take us out of our sympathetic state, reduce our cortisol levels, which rise in times of stress, maybe some holiday stress. And let's talk about what we can do to get ourselves into that parasympathetic, relaxed nervous system state. Okay? Shameless plug. I'm drinking some of our delicious water right from the water cooler. I have it spiked with a little bit of the Pro Reds, one of the Nutritional Frontiers superfood powders, along with liquid minerals. I refer to it as my super soldier juice, and it also helps to lubricate my throat so I can continue talking without losing my voice and getting parched. All right, so as I mentioned, I am a neuromusculoskeletal chiropractor. I believe that stress is a killer. There is no question about that whatsoever. That's what we're here for to discuss, but I'm a mechanical guy. I'm looking for tight muscles. I'm looking for joints that don't move through our fullest ranges of motion, whether we're talking about the spine or the elbows or the knees or the feet or the muscles of the calf or the muscles of the back of the neck. Doesn't matter. That's what we work on. All those muscles have similar properties. All those joints have similar properties. And when we activate them, and when I say activate them, that would be another way of saying stretch tight muscles using pressure point style technique. It's very important that the pressure come perpendicular into the muscle as trigger point work versus massage style work, which is typically done parallel to muscles. Two entirely different techniques have entirely different effects on the nervous system. So when we get these tight muscles to relax through short stretch, the pressure point, do long stretch by taking the whole muscle and moving it, stretching it through a range of motion, it has a certain effect on the nervous system where it helps us to shift from sympathetic to parasympathetic, or maybe even from parasympathetic to more parasympathetic. When we do chiropractic adjustments, which I refer to as fast stretch, we're focused on the joint mechanics. How do we get the joints of the spine? Think about where two spinal bones, two vertebrae come together. We have joints that will allow those two bones to move in bending to the right, bending to the left. They'll rotate right, rotate left. They'll traction, they'll compress. So they move in anywhere on the XYZ coordinate system in 3 dimensions. So we're going to find which planes of motion are those joints stuck or restricted in, and we're going to do a fast stretch, or we're going to do a chiropractic style adjustment into the joints. And once again, we could be talking about the spine. We could be talking about any of the 26 movable bones in each foot. You have 28 bones in each foot. 26 of them are movable, but 206 bones in the human body. So a quarter of our bones are in our feet. Those are pretty important anatomical structures to take good care of. There's a lot of neurology going on in the feet. There's a lot of neurology going on in the joints of the spine. And when we activate that neurology with adjustments and manipulations and mobilizations, what we're essentially doing is we are reestablishing communication between that particular joint and the brain using the whole nervous system in between in order to reestablish those networks. When those networks are established, what do? We slide from a more sympathetic state to a less sympathetic state, from a less sympathetic state to a more parasympathetic state. So not a day goes by when I don't adjust a patient and they don't take a deep breath and say, oh man, I could take a nap right here. Well, there's a reason why. And when a patient says to me, oh, I could take a nap right here, part of me says, please don't. Why don't you go use one of the couches in the waiting room? I got more patients. I can't let you tie up the room. And part of me says, wow, what a great compliment. Thank you for that. That, to me, that means a job well done if you feel like you could just take a nap and you feel so relaxed after being adjusted. So what those adjustments do, once again, we're shifting ourselves more towards a rest and digest, wine and dine, away from fight or flight. We're establishing neurological communication from parts of local specific parts of the body to the brain and the central nervous system. We're enhancing our ability to take deep breaths, especially if we're making adjustments to the mid-back and to the rib cage, which is a big part of my practice strategy. We are, when we establish those networks, we're helping the brain and the body communicate in such a way that we're improving coordination, we're improving our patients' balance, their ability to orient themselves in space. If you have better spatial orientation, if you have better breathing abilities, if you're able to stand up straighter, if your posture is improved, wouldn't it be fair to say you have a better advantage to be able to recognize, interact with, adapt to, and overcome at least your external environment? And because you're breathing so much easier and so much fuller, all that delicious oxygen traveling by blood to every single cell of your body, wouldn't it stand to reason that your internal environment is also gaining benefit and better able to recognize, interact with, adapt to, and overcome the internal environment? So that's another one of my big holiday area tips. Be a chiropractic patient. Our profession has a bad reputation for telling people to come. As long as you hurt, come 3 times a week, maybe 4 until you stop hurting, and then we'll cut you loose, but we'll see you the next time you hurt. That does not work for me. It doesn't work for my patients. It doesn't work for our strategies that we employ here at this World of Wellness Center. The overwhelming majority, my biggest group of patients, my biggest patient population, are people who came to see us initially because they were in some sort of pain or discomfort or had a physical problem. Because we use synergistic but diverse modalities to work on muscles and joints, we're able to help people in fewer visits than other chiropractors who only use one of those modalities. And then once their complaint starts to resolve, they come on an interval basis because they've learned through their own personal experience, and of course my pushing them, nagging them, reminding them, teaching them, explaining, this is part of wellness. And this group of people, my biggest group of people, are people who've bought into what I'm saying and what we're doing here and what we're trying to teach, and have turned chiropractic visits into maybe it's once every 2 weeks, maybe it's 2 times a year. It just simply depends on that particular patient and what their life circumstances might be, what their normal activities of daily living and what kind of demand they place on their bodies. But I'd like to highlight that experience. And if you're listening in and you are not a chiropractic patient, this applies to you. This absolutely applies to you. If you have a nervous system, we can figure out a way to help you. So this is an open invitation for the audience to join us as patients. And if Green Tree in Pittsburgh is inconvenient for you because you live on the other side of the world, maybe you'll find somebody in your area who does similar type of work. And who knows, send us an email. Maybe we can help you find somebody, or at least tell you what questions to ask of a chiropractor in your area. Okay, let's talk about another big, helpful holiday, not just holiday, but life hint to be healthier. Let's do some deep breathing. We've talked about it quite a bit. Let's do a little bit of group exercise and a little bit of group demonstration and some interactiveness. So I'd like everybody to indulge me, and we're going to take a couple 3 deep breaths together. So let's first of all situate ourselves in the appropriate posture. The bottom of my chest down to my belt buckle. I'm going to make myself as tall and as long as I possibly can here. It doesn't matter if I'm standing or if I'm sitting. Either way, you can make yourself long in this region of your body. Now I'm going to think about my scapula, my shoulder blades, the wings on my back, and I'm just going to kind of throw them backwards and down. And without increasing my tension in the most relaxed possible way, I'm thinking about my shoulder blades as being triangles with the point at the bottom, and I'm trying to take that bottom of my shoulder blade and I'm trying to touch my belt buckle with it. Now that's physically impossible, even for the Cirque du Soleil people, but it's a good visualization to throw your shoulders back into a relaxed position. And the next thing we're going to do is we're going to pick our heads up, imagining there's a little eyelet on the top of our skull, and there's a string from the ceiling lifting us up. And now we're in really, really good posture. And you should feel, if you've adopted this posture, you should actually feel more relaxed. So here we are, and without breaking posture, I want to take a deep breath in through my nose, and I want you all to do the same. And since I'm not breaking my posture, you will not see me inhale through my nose and lift my shoulders up. Instead, what you'll see is I'm going to take a deep breath and you're going to see my chest come out and expand. So now my chest is even bigger, and I'm separating out my ribs with this movement to allow my lung space to expand. And what I'm going to do now is I'm going to blow it right out through my mouth. And my chest is going to sink down to the point where it started from. So let's do that again. Big deep breath in through your nose, expanding your chest. We're making ourselves big. Suck in a little bit more air. And we're going to hold this 1,001, 1,002, 1,003, 1,004, and blow out through your mouth. Now I counted 1,004, plus there was a little bit of time as I inhaled, plus there was a little bit of time as I exhaled. So let's say that was a 6-second breath from the time that I took my breath in to the time that I blew out. 60 seconds in a minute, 6-second breath. That should take me at a pace where I'm taking 10 breaths per minute. The textbook normal says 12 to 20 breaths per minute. When I examine patients, when I meet with somebody for the first time, as part of my examination, I got my hand on their trapezius muscle right here by their first rib, and I'm feeling it rise and fall, and I'm looking at my second hand on my watch, and I'm counting how many times in a minute does somebody breathe. It's very, very rare for me to see somebody who takes as few as 20 breaths per minute. Now, I'm willing to concede a point. People are new patients in a place where they're unaccustomed to being, working with a new chiropractor. Maybe they're a little bit nervous. Maybe their anxiety is a little bit higher than it normally is. Maybe their stress level is raised just simply by virtue of being here. It's all possible. I can be on board with that. There's no reason for people to be taking 22 to 25 breaths per minute. That's practically hyperventilating. Wouldn't you want your body to be a more efficient, well-relaxed, easy to operate unit of collective body parts? So if we can do this exercise and we can train ourselves to take 10 deep breaths per minute, and when we're out of our exercise mode, maybe that gets to 12 or 15 once we become pretty good at this. So let's do this. Let's take 2 or 3 more deep breaths. Body's in good posture. Shoulders are back. Head is up. Long in the abdomen. We're tall here. Deep breath in through your nose. expanding, holding, holding some more, holding again, out through your mouths. Another one. Deep breath in through your nose. We're holding and expanding without compromising our posture. Big in the torso as we come out this way, not big this way. And blow out through your mouths. Okay, so my question to the people who are indulging me here at 2419 Baldwick Road, which is the same question I'm asking to the people in Cyberland. We just took 2 very slow, deep breaths. Did it make you feel lightheaded? Did it feel fatiguing? Did you feel a change in your body temperature? Anybody want to volunteer their experience? Anybody in Cyberland want to volunteer their experience? Not joining in. Okay. All of those are responses that I've had in the past. I felt like I took these couple, 3 deep breaths, and it was really like I felt my body temperature calming down and getting either a little warmer or a little cooler, depending on where I was to begin with. It felt fatiguing. I felt a pinching in my back. Well, first of all, those are signs that your body's just not used to getting that much oxygen at once. So I would take that as a warning that if you're feeling different, if 2 deep breaths are making you feel lightheaded, the only right answer is it felt calming. If it felt anything else other than calming, that's a sign that your body is adapting to getting this much oxygen in, and it's a foreign experience for you, which is something that I highly, highly encourage you to correct if you want to reduce your stress levels and reduce your cortisol levels and start to work on mechanisms to lower your blood pressure, lower your heart rate, lower your sugar levels, and just generally be systemically more healthy and systemically more relaxed. Now, if you took that deep breath and you felt like this posture is really uncomfortable for me, I feel a pinching in my mid-back. Now, that's a sign that a little bit of tightness in your musculature, probably some restriction in the movement of your thoracic spine and the way your ribs articulate with your thoracic spine, and the way they bucket handle up like so is part of the movement. And that might be something that your friendly neighborhood chiropractor can help you with. Let's take another 2 deep breaths and then move on. So we're in our good posture. Shoulder blades are down and back, chest is up, long in the abdomen, head is up. Big deep breath in through your nose. Everything is expanding some more, expanding again. We're holding, and blow out through your mouths. One more time. Big deep breath in through your nose. Everything is expanding, and we're holding it, expanding some more. Our lungs are saying, thank you for feeding me. Our rib cage is widening and bucket handling out. And let's blow out through our mouths. You should find that relaxing. Okay, so holiday tip number 1. Become a chiropractic patient or remain a chiropractic. No, I'm sorry. Holiday tip number 1, be yourself. Don't feel pressured into eating giant holiday meals. Don't feel pressured into drinking large amounts of holiday alcohol that you're just simply not used to. Don't compromise who you are and your strategies for eating and your strategies for drinking to accommodate to other people just because it's the holiday. Holiday tip number 2, be a chiropractic patient. We can help you. Holiday tip number 3, do some deep breathing exercises. Now, we talked about breathing at those 10 breaths per minute, maybe even less pace or cadence. What if you took a minute 5 times a day, 1 minute, and you just devoted that minute to sitting or standing in your best possible posture, breathing in through your nose, allowing your rib cage to expand, compressing your rib cage and using your diaphragm to push the air out. 1 minute it's 10 deep breaths, another minute it's 8, another time it's back to 10, and you're just treating it like an exercise, because what you want to do is employ simple strategies to help shift your body out of a fight or flight sympathetic nervous system status into a wine and dine, rest and digest parasympathetic state. So there you go. Exercise number 1 for the purposes of everything we're going over here today. Because this is a great, fully stocked, large nutrition store. I don't think you can see it on my I'm facing the nutrition store. We'd have to do some major camera angle shift. I'm not going to impose on IT Savant Phil to do that. I'm going to invite you to look at our website so you can see how absolutely vast our nutrition store is here. But let's talk about what you can do nutritionally to help reduce stress, to help to make that sympathetic to parasympathetic shift. 1, ashwagandha. Ashwagandha is an herb from the Ayurvedic medicine school of thought, and it just simply helps to systemically relax your body. Omega-3 fatty acids. If you're a nutritional frontiers aficionado, omega-3D. Omega-3D is a highly concentrated, when I say concentrated, I mean the active ingredients in fish oil are EPA and DHA. Eric Paul Anthony, David Henry Anthony. EPA and DHA. And these are fatty acids. So why not blend them with a fat soluble vitamin like vitamin D? So omega-3D fish oil. We're going to have bonus vitamin D, and we're going to have highly concentrated fish oil, which is going to help to shift your nervous system to that relaxed state. It's going to act as an anti-inflammatory. It's going to act for cardiovascular health. All the things that we see in a sympathetic dominant nervous system. We have too much heart rate. We have too much blood pressure. We have too much nervous system miscommunication with the body. Omega-3D in specific, omega fatty acids or fish oil in general help to correct that. Vitamin C. When we think about that increase of sympathetic nervous system, and we think about that cortisol buildup, and we think about a decrease of immune system function, one of the chief activities of vitamin C is to help fortify the immune system. So we're using backwards to forwards, or a feedback mechanism, feedback loop, to help teach our nervous system to calm down by boosting our immune system. Now, we talked about vitamin D for just a split second ago. The vitamin D is also critically important for good immune system function, and it's right there inside of or bundled with the fish oil that I'm highlighted. So we talk about ashwagandha. We can talk about the omega-3 fatty acids or the omega-3D. We talk about the vitamin C. Nutritional Frontiers puts out something called a buffered C, which the buffered means that it releases in your stomach in such a way that the stomach acid doesn't neutralize it. Another nutrient that I want to highlight that will help to make this shift towards rest and digest and away from fight or flight is magnesium. Now, when we talk about when we talk to patients about what do we do from a chemical standpoint, and nutrition is chemistry, What do we do from a chemical standpoint to help tight muscles to relax? Number one ingredient that I can recommend for you is magnesium. And the magnesium is doing what? It's helping shift us away from the sympathetic to the parasympathetic. The sympathetic nervous system is focused on winding tight, fight or flight. And the magnesium helps take us out of that status. Now, from my own personal clinical philosophy and the way I like to do things and the way I teach my patients, I want to make this as simple as possible. I like just vitamins, minerals. When we take a proprietary blend, less is more. You don't have to have 14 ingredients in it. I like to have simple, easy, actionable strategies. Some people like proprietary blends that are a mix of a dozen different supplements mixed into one capsule or one powder or one delivery system. And if you study the Nutritional Frontiers line, Calm Day. I can't say that Calm Day is going to replace the ashwagandha and the omega-3 fatty acids and the vitamin C and the magnesium, but I can certainly tell you that if you just said to me, I'm really feeling pretty stressed, I want to take one thing only. I don't like swallowing pills all that much, whether they're medication or whether they're nutritional supplements or who knows. I don't like it. I just want to do one thing. I would have to recommend that you take the Calm Day. So far, so good? Comments, moral outrages, questions, irritations, nuances, nuisances?
Somebody says you prefer that fish oil over SPMs.
The question is, do I prefer that fish oil over SPMs? And that's a great question. The SPM, when you think about the SPMs are a more concentrated fish oil with a few extra healing nutrients that are blended in. I can't say that I prefer one or the other. I think about time and space and what's appropriate and for which condition. And if somebody had, for example, an acute sprained ankle and it was swollen the size of a softball or a soccer ball, I would take the SPM over the fish oil every day, twice on Fridays. The purpose of our conversation and our discussion of what we're doing here is not about acute injuries. It's simple strategies to shift the nervous system into more of a relaxed state, and which products are going to work the best together, and how are we gonna keep this more mild and less acute care type of strategy. So in the instances that I'm describing for the purposes of this workshop, I would absolutely prefer the omega-3D. In the context of a inflammatory condition of a fresh injury, I would absolutely prefer to have the SPMs. So that was an excellent question, whoever typed that in and took the time to express their curiosity. And I hope I answered that adequately. Okay. All right, another question.
It's about they're asking if Adam is still here. Haven't seen him around. Also, rest in peace, Dr. Weiner.
Okay. The next two questions are points. One is somebody said, rest in peace, Dr. Weiner. It's been 6 years since Dr. Weiner passed away, and he's missed here. He's missed by our group, our population. I'm sure he's missed in communities that he was part of that I know nothing about. And, anytime somebody acknowledges Dr. Weiner or says, rest in peace, Dr. Weiner, or asks about him, we have to acknowledge that. Dr. Weiner was the founder of what it is that we do here at this facility. I don't think any of us would be doing what we're doing here at this location without his establishment of our business here. I don't even know how else to put it. So to whoever it was that said, rest in peace, Dr. Weiner, thank you for bringing that out. The other person asks, where's Adam? Adam did muscle therapy here. Adam, Jacob, and Herman were muscle therapists. They focus primarily, but not exclusively, on pressure point style work in order to get tight muscles to relax. All three of those guys are just absolutely fantastic practitioners. I can't say enough good things about any of those three. Adam retired from muscle therapy. He has family that's a short drive away in Ohio and in Michigan, and I know he spends a lot of time with them. And he helps out with Nutritional Frontiers, doing some work at their facility from time to time. Adam is also missed, but if you hang out here long enough, you might see him passing through. I hope that I hope that covers it. Okay, so we talked about what can I do for you as a chiropractor to help you reduce your stress levels and to relax tight muscles and to mobilize your joints and to help you achieve this slant more towards parasympathetic nervous system and less towards sympathetic. We talked about things that in the form of nutrients and deep breathing exercises. What can you do for yourself? The next thing I want to talk about is what can I teach you how to do? Things that really are a little bit more complicated, but they're exercises and self-applied treatment. And one of my favorites is called emotional freedom technique. And what it is a self-applied therapy that's based on tapping specific acupuncture points in your body. Now, this was popularized in the 19. I mean, this is part of Chinese medicine. Acupuncture is as old as acupuncture is. Pressure point is just as old. I don't know the lineage. I'm not tracing it back. I'm not doing a history class here, but it was established in the United States in the I believe the early mid 1970s by a psychologist named Roger Callahan. And Dr. Callahan was working with a group of guys who had returned from the Vietnam War, and they had all been diagnosed with what was called Vietnam War syndrome, which today is known as post-traumatic stress disorder. Now, PTSD is real, and it's very intense, and it's difficult to treat, and it has to be acknowledged. So anyhow, Dr. Callahan is working with this group or this population of people, and they're making no progress. Nothing in traditional psychology is helping them. And Dr. Callahan he's just one of these curious guys who reads everything he can get his hands on and looks for practical application and what more can I do with my patients to help them. He says, you know what, I've struck out with everything I know. Let me try something new. And so he taught these what we now know to be PTSD patients how to do emotional freedom technique or tapping. So what you do is you got to have very specific affirmations that you're saying to yourself or that you're saying out loud as you tap on specific parts of your body in a protocol fashion. And what we're going to do now is we're going to run through the tapping. I'm going to show you all, everybody listening in, what to do. But we're going to do it without affirmations and without mantras, and we're just simply going to tap using for the purposes of the drill, we're going to use our right index and middle finger tips, and we're going to try to focus on the left side of our bodies, and we're going to do this exercise together without saying anything, without acknowledging problems, without making corrective statements. And if this is something that you're curious about or you want to drill down on or that you want more of, it's very easy to research online. If you're local to Pittsburgh, come in and schedule with me and we can talk about it. We can run through it as it's specific and tailored to you or individual needs. If you're not local to Pittsburgh and you want more of this, you can reach out to me through Facebook. But anyhow, here's what we're going to do. First of all, I'm gonna take my glasses off for this. With my right index and middle, I'm gonna focus on my left hand for a second. If I were going to do a karate chop, if I were going to break a board, I think about that surface on the knife edge of my left hand, on my fifth finger, my pinky, and where would I strike the board to break it? And I'm just going to tap. I'm just going to use that index and middle, and I'm going to tap on that spot. And while I'm tapping, I'm going to focus on my breathing, where I'm going to make sure that I'm breathing in through my nose and out through my mouth, and trying to relax my body into good posture as much as I possibly can while I tap. And then I'm going to move from that karate chop point to the top of my head. Now, when we go to the doctor's office and we're going to be measured, everybody, whether you're 4'8" or 6'8", you want to squeeze out that last little tiny bit of height and be measured and recorded there. So find the tallest part of your head, and that's exactly what you're going to tap on using your index and middle finger. And we're still breathing in through our noses, holding it in good posture, and blowing out through our mouths. And now what we're going to do is we're going to move to the spot where our eyebrow ends and our bridge of our nose begins, and I'm going to tap right into that spot. Now, if we were really doing this purposefully and for a specific reason that's tailor-made towards the individual, and I've done this with a number of police officers related to their jobs, we would be saying making very specific statements about our own well-being while we do this. But once again, for the purposes of our drill here, we're just tapping on the spots. And now I'm going to move over to the far end of my eyebrow, out closer to my cheek, to the soft spot where the flesh is almost hollow, right above the ridge of my cheekbone. And I'm going to tap in that spot, all the while breathing deeply in through my nose, feeling my chest cavity expand and blowing out through my mouth. And now I'm going to shift down underneath my eye. There's the eye socket, the orbital socket, and I'm right underneath, tapping on the bottom of the bone in that spot below my eyeball. Tapping, 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 tapping some more, breathing deeply. And now I'm going to shift to the spot where I'm right smack in that indenture above my top lip, in the middle of my mustache, and I'm tapping right above my mouth. And I keep tapping here, thinking about breathing deeply some more. And now I'm going to come down below my bottom lip, almost on a straight line right down. There's an indenture right above the top of my chin, and I'm tapping in that spot. Tapping, 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 breathing deeply, blowing out through my mouth and shifting. Now I'm going to come to the inside of my collarbone. My collarbone is this bone right here, travels around the top of my chest, and then it just sort of comes to an abrupt end, and there's a fleshy spot right at the top of where my sternum and my collarbone meet, and I'm going to tap into that fleshy spot. And I'm still breathing deeply in through my nose, out through my mouth, feeling my chest cavity expand as I breathe. And I'm going to make another shift. And I think about my armpit as being a seam. And I'm going to travel down that seam to the point where I feel my bottom of my rib cage. And I'm tapping right there on that bottom rib in the seam dictated by my armpit. Breathing in through my nose. My posture's still good. My chest is expanding. And I'm blowing out through my mouth. And now I'm going to shift to my thumb. So I'm going to be on the aspect of my thumbnail that if I put my thumb next to the rest of my fingers, the piece of thumbnail that's furthest away from my index finger, that's where I'm going to tap. And my posture is good, and I'm breathing in through my nose and holding it and blowing it out through my mouth. And now I'm shifting to the part of my index finger that's closer to my thumb, further from my middle finger. And I'm tapping, tapping, tapping some more, all the while breathing deeply in through my nose. My chest is expanding while I'm in good posture. I'm blowing out through my mouth, and now I'm moving to that corollary spot on the middle of my index fingernail, closer to my middle finger, closer to my index, further away from my ring finger, and the drill just continues. We're breathing deeply, and we're tapping on the side of the nail. And all these points that we're looking for are very small. They're tiny little points, but because we have so much surface area with two fingertips, we're going to get it right, even accidentally. Now what we're going to do is we're going to skip the ring finger and tap on the inside of the fingernail on the fifth finger, the pinky finger, closer to the ring finger. And we're tapping, and we just keep tapping and tapping some more and tapping again, and we're still breathing deeply. And now we're going to make a shift to the fleshy musculature in between the pinky finger and the ring finger. So we're on the outside of our hand, like so, the back of our hand towards the pinky finger side, and we're tapping into that musculature, and we're just going to stare straight ahead and shut your eyes and keep tapping, even with closed eyes. Now I want you to, and you're going to look down and to your left as you tap. And now we're going to go down and to our right as we tap. Now we're going to roll our eyes clockwise as we continue to tap that spot. And we're going to roll our eyes counterclockwise as we tap that spot. Now, in the privacy of your own mind, I want you to keep tapping that spot. But I want you to hear your favorite song playing, maybe even blasting. And we're moving away from our favorite song, and in the privacy of our minds, we're just going to count to 10. We're going to synchronize the art side of our brain with the number side of our brain by thinking about the dichotomy of music and numbers, and relax. Now, that's emotional freedom technique. For the people who've joined with me and indulged me and played along with, you might feel a little bit of an energetic shift. You might feel like you're a little bit lighter. You might feel a little bit more aware. You might feel a little bit more alert. And what that is your shift away from sympathetic and into parasympathetic nervous system. This is something that I do. I have a particularly challenging patient. Maybe they were just harder to adjust and took more out of me physically. Maybe they had a narrative of something horrible that went wrong that I sat there and listened to and felt some sympathy towards them. Either way, I have to be ready for my next patient. So there's a very good chance that I might acknowledge my next patient in the waiting room and say, I'll be with you in 2 minutes. And I go to my office and either do some deep breathing or some tapping in order to reset myself. So my holiday tips for you are: be yourself, be a chiropractic patient, take good nutrients, and do deep breathing exercises, and learn how to do emotional freedom technique to help center yourself and reduce your anxiety. So are there any from the live crowd? Any questions, comments, moral outrages? And a hush fell over the room. How about Cyberland? We're good. So I want to thank you all for your very kind attention. For the people who indulged me and played along with me, thank you so much. I wish everybody health, happiness, safety, and a great holiday season. We celebrate Hanukkah, Christmas, Kwanzaa, anything else that you might want to celebrate, and a wonderful start to 2024. And I hope if you're local to Pittsburgh that we get a chance to meet you and you become new patients, new customers, new clientele, new friends of our world of wellness.